As we've been regularly talking about here on CP24 Breakfast, the cases of measles continues to rise in our province. So what does that mean for Ontarians? What can we do to help protect ourselves against further spread?
We're joined live this morning by Ontario's Chief Medical Officer of Health, Dr. Kieran Moore. Shed some more light on this topic. Dr. Moore, good morning to you. Good to see you about this. The measles here, this was a disease that we thought had basically been eliminated, but clearly it's back here. And a lot of it is in southwestern Ontario. What are your main concerns here about this current outbreak and how it continues to grow even in the last several days?
Yeah, good morning, Nick and Jennifer, and thanks so much. We have seen an increase in cases in the Southwest. I just want to assure Ontarians that our health units, our family physicians are doing their best to continue to provide immunization to the communities, as well as to try to limit the spread of this infection in the Southwest, predominantly in 4 health units. And we're working very closely with them to try to support the communities and try to support the outbreak management to limit the spread of measles. It's a global phenomenon, and sadly, it is active in the Southwest of Ontario.
Mm-hmm. Now, fortunately, right now the outbreak size is about 1,200, but we know that no one has died here in Canada. Different situation in the United States. We know how transmissible this disease is, Dr. Kieran Moore. And I think that what we're hearing is that it's happening in a lot of cases where children are not vaccinated. So what's being done now to get the message out to parents that if your child is not vaccinated between those certain ages, it's time for them to do so, because this isn't just a dormant disease that's going to go away. How are you targeting the messaging and getting that across to parents?
Well, great question, and thanks so much. So we absolutely need high levels of immunization across Ontario. We want to keep our children protected. We have a great vaccine that's after 2 doses, around 97% protective against acquiring measles. And measles is no simple infection. It does have complications like pneumonia, inflammation to the brain, and it can cause serious illness. The vast majority of cases in Ontario that are occurring in children, adolescents, 95% of them are unvaccinated. And it is preventable with such a great vaccine that's available. So across this province, our family physicians, our community health centers, our public health agencies are trying to promote the vaccine. So we certainly will have central communication on promoting the vaccine as well, and have done thanks to your great help as well. But we need to do more. It's a global increase in measles risk across the planet, and we need to protect Ontarians as best we can.
Dr. Moore, how much of a challenge is it, coming out of the pandemic, a lot of people sort of had vaccine skepticism. There's a lot of sort of false information being pushed out on social media. And, and we're seeing kind of partly the results of that here with, unvaccinated children on this highly transmissible disease here. What is this challenge like for public health, for a doctor like yourself to sort of combat this?
It is a significant challenge, and we all, at every kitchen table, at every clinical encounter with patients, have to promote the safe, effective use of this vaccine. We have a 50-year history of the safety of this vaccine. It has helped us in Ontario eliminate measles since 1998, and clearly that's threatened with this ongoing activity in Ontario. So it is very safe, very effective. 2 doses is 97% effective against getting measles and all of its complications. So I hope every healthcare worker at every interface is supporting this safe, effective vaccine to try to maximize the community protection that we have. Getting vaccinated protects those that can't get vaccinated, like the children with immune disorders or allergies to some of the components. It really is an active community. It protects each other, protects our families, and I hope you're hearing my sincere enthusiasm for staying up to date with measles vaccination.
Mm-hmm. And Dr. Moore, for parents listening, how easy is it to get access to the measles vaccine? We know that there's a shortage of family doctors right now. I know we talk about vaccine hesitancy, but could any of this be related to the shortage of people finding doctors? Can this be administered in a pharmacy, for example?
Not in a pharmacy yet, but it can be administered in your local public health agency. So please, there's 29 of them across the province. Contact your local public health agency if you're having any issues in getting access to the vaccine. All primary care physicians should be able to provide the vaccine. Community health centers often will see patients that are unattached as well. So there are options. You can phone 811 as well. But I would first contact local public health agency if you're having any troubles finding vaccine.
Okay, that is Dr. Kieran Moore, Ontario's Chief Medical Officer of Health. Appreciate the time this morning. Thanks for being here.
Thank you, Dr. Moore.
Thanks so much.